There are a lot of studies that have suggested that use of e-cigarettes can help people quit smoking. However, there are also other studies that have failed to clearly establish that e-cigarettes prevent or help people quit smoking. So it's still a very early time when you talk about how helpful e-cigarettes are. We should, however, be mindful of potential risks with e-cigarettes, which still have to be studied carefully. So the notion that somehow if you use e-cigarettes, one is protected from developing cancer or other medical problems is a leap of faith. Like anything else, when you have a new pharmacological product or a chemical delivery system, we need to study that carefully. And the FDA recently came out with a number of important initiatives that regulates e-cigarettes so that it is not available to teenagers and kids, which is important because in many instances, starting off with e-cigarettes can end up being a gateway to developing cigarette smoking. So we want to minimize access for our kids to these products. And for people with established smoking habits, it's important that you talk with your physician about how e-cigarettes might help you quit smoking or not. But to, as a society, adopt and switch from one form of cigarette to another form of cigarette without studying it carefully is a risk. And we don't want to find out 20 years later that a number of patients have certain medical problem or certain cancer because we didn't have enough information earlier on. And then you have already let the horse off the barn, and now you're trying to control it back.